Hello everyone, Noescano. I hope this message finds everybody in our community doing well and staying safe. I wanted to take some time today to provide you with some important updates and reminders as we all continue to navigate these unprecedented circumstances. First and foremost, I want to remind everyone how important it is that each of us continues to do our part to keep ourselves, our loved ones, and our community safe. There are suspected COVID-19 cases on both territories, so it is here. The COVID-19 response is reaching a critical stage, and there have been some encouraging signs reported about the nationwide efforts to slow the spread of the virus. It is more important than ever that we stay vigilant in these efforts. Remember that people can still carry and spread the COVID-19 virus even without showing any symptoms. That is why it is especially important to eliminate any unnecessary travel, and everyone should be staying home, except for essential activities like seeking medical care, buying groceries, and checking on or delivering food and supplies to a loved one. If you are not feeling well, call your healthcare provider first before seeking treatment. Each household should designate one person to go out for groceries and essential supplies, and do not take family members on these errands. If you are delivering food, medicine, or supplies to a loved one, please do a simple knock and drop. Call them ahead of time so they know you are coming and arrange a safe drop location. Then simply knock on their door and leave the items. Do not go into their homes to visit. Social distancing remains vitally important. People should not be gathering in groups at private homes or parks or other public places. I know this prolonged response has been difficult for all of us, but if everyone continues to do their part, the sooner we will be able to safely begin a return to normal. There are safe activities that you can do outside during these times. Take a walk, go for a run, hike or a bike ride, but remember to maintain a safe distance. The fresh air and physical activity will be good for you and your mind. And remember to eat well and get plenty of rest. As I have mentioned previously, our COVID-19 task force has been working around the clock throughout this situation, and I want to commend them for their hard work and dedication. I also want to acknowledge our emergency management team under the direction of Mike Gates for their tireless efforts during this response. Here's a summary of some of the items we have been working on. First, let me talk about testing, which has been a hot topic across this country and nation. The Seneca Nation health system does not currently have the ability to test for COVID-19. These supplies are in high demand across the country. Any patients at the health system who are in need of testing are being referred to the respective county health department. That is the appropriate procedure. We have been actively pursuing test kits and testing analyzers. If we are able to secure the needed supplies, then we will test at the health centers to the extent possible. In that scenario, any positive test would still be referred to the respective county health department for further action. We also understand that information is a vital resource during this time. The Seneca Nation Coronavirus Response Hub website provides important information and updates to our members. You can reach that site by visiting sni.org and look for the large red banner. We have many additional lines of communication to help keep our members informed, including the Seneca Media Facebook page, the Nation newsletter site, WGWE, along with various YouTube updates and videos. Please check these resources regularly. Taking care of our elders remains a top priority for our administration. The Seneca Nation Housing Authority has essentially stopped all outside visitation at our elder housing complexes, and we are encouraging families to simply drop off needed supplies and not stay for a visit. Elders living at the Oak Tree and 44 Seneca complexes have been provided masks as an extra precaution, and housing staff are maintaining close communication with the residents to see if they are in need of anything. Since many of our elders may not have internet service, a coronavirus information packet was recently delivered to all elders who live on territory. We also have team members making calls to elders who live on territory to check in on them. If any elders who live on territory who would like a copy of our various videos and updates, we will work to provide them with a DVD copy or a flash drive. If they have a newer model television, requests can be made by calling Barbara Hill from the Seneca Nation Media at 945-1790, extension 3921. The Seneca media team will make every effort to handle these requests in a timely manner, just as we strive to keep our community informed and our elders cared for. The nation continues to provide essential services on our territories. It is important for our community to know that we are providing these essential services in a safe manner. Everyone entering our nation facilities is having their temperatures taken to ensure that nobody is entering a nation building with a fever. This includes the Oak Tree and 44 Seneca housing complexes. In addition, all deliveries to our buildings are to stop at the front door or reception area. To ensure that all essential services continue, we have created a job bank of nation employees who were recently laid off. These employees may be called in to assist other departments with the continued delivery of essential services, and I want to thank them for their willingness to support our nation in this way. Finally, I want to assure you that our nation and my administration have taken this pandemic seriously. We have made some difficult decisions over the past few weeks, but everything we have done and will do is driven by one simple principle: to do what is best to protect the Seneca people. Your health and safety remains our highest priority, and we will take every step necessary to keep our nation strong, and we are going to get through this period together. I wish you and your families continued good health. Stay safe and connected, and continue to look out for one another. Yahweh.